Hi everyone, thanks for joining me. I'm Joel Keenan, the Angry Doctor. Welcome to another episode in which I just want to follow up briefly on a talk I gave last month about HHS Secretary Robert F. Kennedy Jr. And in that talk I criticized his approach to vaccines and to measles in particular, blamed him in part for the epidemic of measles that is now overtaking the United States. There were deaths from this last year. This year, cases are on track to double compared to last year in the United States. And I argued that Secretary Kennedy had been an effective advocate against vaccines for many years, and that was part of the reason this has all occurred. And that as HHS Secretary, he had appointed people like Dr. Kirk Malone to chair his Vaccine Advisory Committee. And Dr. Malone is himself a vaccine antagonist, an opponent, arguing that all vaccines should be optional, including polio, Dr. Malone had said. Since then, Secretary Kennedy testified before Congress last month, and you may have seen that. And in that testimony, he said, nope, everything I just said is not true. He is not against vaccines, and he has never been anti-vaccine. He testified to this under oath before Congress last month, and it would be great news if it were true, but it's not. In 2021, he posted on Twitter what you see here, alleging that thousands of people had been injured by the COVID vaccine and that 13 deaths had been reported in December alone that year. This was not an endorsement of vaccines. This was obviously in opposition to vaccines. It happens to not be true as well. That data was reported from a self-reported web database. Anybody could log on and log their complaint or report about COVID, whether it was true or not. So it was completely unverified data. That same year in 2021, he called the COVID vaccine the deadliest vaccine ever made. That's not an endorsement of vaccines. That's obviously in addition to them. 2 years later, in 2023, he said he believes autism comes from vaccines. That's consistent with lots of statements like that he's made over the years. In 2025, he said the MMR vaccine, measles, mumps, rubella vaccine, causes all the illness that measles itself causes. That is to say, or to imply, that vaccines are just as dangerous as the illnesses they're trying to prevent, and leading to deaths every year, he said. In 2019, he joined a group of people opposing requirements for vaccines, and he wasn't standing there in opposition to them saying, raise your hand if you're a dope. He was supporting that group. In an interview with his boss, President Trump, the president said, this is President Trump now speaking, I think I can say there are certain groups of people that don't take vaccines and don't take any pills and don't have autism. Does that tell you something, Trump said, and then asked, is that a correct statement, by the way? Good question, President Trump. No, it's not. But Secretary Kennedy, who was there for that interview, said he agreed, saying there are some studies that suggest that what President Trump had just suggested, that maybe if you don't take vaccines and you don't take pills, you won't get autism. That's true, Secretary Kennedy said, with the Amish, for example. And that's not true. The Amish do take pills, they do get vaccinated, and they do get autism. All three of those occur in the Amish community. It's just not true. At the hearing, Secretary Kennedy said this can't be his fault because the measles epidemic is global and preceded his tenure as HHS Secretary. What a dumb thing to say. You know, if Ted, Billy, and Bobby rob a convenience store, the fact that Billy and Bobby are guilty does not exonerate Ted. Just because you're not entirely responsible for something doesn't mean you're not responsible for something. And regarding this happening before he took office, well, he's been advocating against vaccines for years, as I just showed. Everybody knows that. It was an absurd thing for him to say. For me, the most frustrating, exasperating part of that hearing, that congressional hearing last month, came when Republican congressmen and women spoke in support of Secretary Kennedy. And one of them was Congresswoman Harshbarger, who herself is a pharmacist, by the way, so she knows or ought to know something about organic chemistry. Congresswoman Harshbarger lauded Secretary Kennedy for, as she said, expanding his access to peptides, expanding our access to peptides. This is preposterous. A peptide is a pair of amino acids. If you want access, amino acids are as you know, the building blocks of protein. If you want access to a peptide, walk into Market Basket. Can you do that? Then you've got access. Buy a potato or a lentil. There's your access. There are all the peptides you can eat. They're right there in the food. We don't need Secretary Kennedy to help us get access to peptides. It's just a preposterous thing to say. And Kennedy thanked her for that, saying he's happy to have her help her refute Democrat talking points that somehow he caused the measles epidemic. That's not what people are saying. We're saying he helped cause it, and he sure has. He's in a really influential position and doing a lot of damage. Right now, he's leading HHS in a $40 to $50 million research project in an effort to show the potential dangers to vaccines. He's doubling down on his position despite what he says publicly. That's really what he's up to. So what he said is just not true. And you know, I remember when my son Aiden was about 4 years old, I got home from work one late afternoon, and he said, Dad, come on upstairs, I want to show you something. And I followed him upstairs. And there in the hallway, on the wall adjoining the bathroom, it was covered in toothpaste. And he pointed to the wall covered in toothpaste and said, Dad, look what I didn't do. That is the argument of a 4-year-old. And it's exactly analogous to Secretary Kennedy's argument that he offered before Congress. I have never been anti-vaccine. It's a preposterous, demonstrably false statement. Anybody could see that that isn't true. And yet he has the gall to make that argument. And that's where we are with this guy. That's where we are with the vaccine program in the United States. We have a big problem. I remember when I was about 15, I was talking to my father about somebody running for Congress. And I remember saying, well, I like this candidate, Dad, because he's got XYZ going for him. And my father said, I like what he has going for him, Joel, but I don't like what he lacks. And I said, what's that? And he said, prudence. And I thought, what's prudence got to do with anything? I had no idea, and how could I? I was a teenage boy. If you do a Venn diagram of prudence and teenage boys, there's no intersection. One has nothing to do with the other. And that's because in order to have prudence, you've got to have 3 qualities. And if you have those 3 qualities, you're prudent. And if you don't have them, you can never be prudent. And by the way, prudence is nothing more than taking reasonable care to avoid a bad outcome. It's a form of good judgment. And that's what it is. The capacity to take reasonable care to avoid a bad outcome. That's being prudent. To do that, to be able to do that, you've got to have experience, meaning you have to live long enough to screw up, to appreciate the value of prudence. And you can't be a complete dope. You don't have to be bright, but you can't be a complete dope. And third, and this is the tricky part for some people, you've got to be mature. And in this context, maturity means nothing more than valuing what prudence has to offer. That's maturity in this context. And, you know, Secretary Kennedy has two of those three qualities. He's got experience. He's lived a long and complicated life with lots of ups and downs in his life, no question about it. And whatever else you think about him, he's a bright man. He really is. But what he lacks is maturity. And I have no idea why. I don't know what happened to him in his life. I don't want to know. I'm not a therapist, a psychologist, or a psychiatrist. I don't know what's wrong with him. But he is imprudent, and he's an immature man, and he's not suited, he's not qualified to hold the position that he holds, and he's doing real damage as we speak. And we're in trouble because of it. I got an email after that last talk that I gave about Secretary Kennedy from one of my patients who said, listen, I take your point, but what are we supposed to do about this? And that's a good question. We've got a midterm election coming up in the fall, and that man needs to be removed from office. Secretary Kennedy I'm talking about now. And there is on the floor of the House, it's been offered a bill for impeachment, to impeach him and remove him from office. And that's obviously not going to go anywhere with the current Republican Congress. But this man needs to be removed. And it's up to us to do it. So I think what's coming up in November is really important for lots of reasons, and I understand there are a lot of other issues that I have nothing to say about. But this is a public health issue. And this guy really is doing real damage to the United States. And it's up to us, the voters, to put into the House of Representatives and in the Senate, who will try him if he is impeached, people who will take this seriously and help us get our health care public policy back on the right track. My next talk I want to give you soon about insulin resistance. I have some ideas about how to avoid that, and I look forward to telling you about that. Thanks for joining me today. I'll see you soon. Take care. Bye.